Hello students, welcome back. Today we talk about the mandibular nerve. Before going to the mandibular nerve, some osteological considerations. We have done that this is called the squamous part of the temporal bone. And here the anterior part of the mandibular fossa is also formed by the squamous part of the temporal bone. This is the squamotympanic fissure, and this is the tympanic plate, which is the tympanic part of the temporal bone. So we have the squamous part of temporal bone, the tympanic part of temporal bone, the mastoid process, the styloid process, and then if we see the inside of the skull, we see this hard rock-like part, which is called the petrous part of temporal bone. So this is the petrous part of temporal bone, this one. So this petrous part of temporal bone, in relation to its apex, there is a depression here, and this depression is for the trigeminal ganglion. And from the trigeminal ganglion, the ophthalmic division of trigeminal nerve is entering the superior orbital fissure. And from the trigeminal ganglion, the maxillary division is entering into the foramen rotundum. So this one is the foramen rotundum here. And then it goes into the pterygopalatine fossa. From the trigeminal ganglion, the mandibular division is passing into this oval foramen called the foramen ovale, and posterolateral to it lies the foramen spinosum. So if I take this probe here and pass it through the foramen ovale, you can see this piece of wood is now passing through the foramen ovale. And then if I pass it through the foramen spinosum, it comes out to be this one, posterolateral to the foramen ovale. If we look at the skull from the inferior aspect, you can make out that this is the foramen ovale, oval foramen, and this is the foramen spinosum. And this foramen spinosum lies in relation to the spine of sphenoid bone. So this is the spine of sphenoid bone. So this mandibular nerve, it arises from this depression. Here lies the trigeminal ganglion. So from the trigeminal ganglion, the mandibular nerve arises via sensory and motor roots, and then it passes through the foramen ovale. And as soon as it passes through the foramen ovale, the larger sensory and the smaller motor root, they unite to form the main trunk of the mandibular nerve. So that is formed in the infratemporal fossa, just below the foramen ovale. Now this main trunk of mandibular nerve gives off two branches. And to show the branches of mandibular nerve, I will now share my screen. So here you can make out that as soon as the main trunk of mandibular nerve is formed below the foramen ovale, it gives off a branch which is called the nervus spinosus. Now this nervus spinosus enters back into the skull, passing through the foramen spinosum along with the middle meningeal artery. Now this middle meningeal artery was lying posterior to lateral pterygoid. So this middle meningeal artery along with the nervus spinosus arising from main trunk goes back into the skull, and this nervus spinosus supplies the dura mater of the middle cranial fossa. It is also called the meningeal branch of mandibular nerve arising from the main trunk of mandibular nerve. The other branch from the main trunk of mandibular nerve is the nerve to medial pterygoid. Now this nerve to medial pterygoid supplies the deep surface of the medial pterygoid muscle, and it also supplies the tensor tympani and the tensor veli palatii. Tensor tympani being a muscle of middle ear, and tensor veli palatii being a muscle of the soft palate. Then the mandibular nerve gives the anterior branch and the posterior branch. So the anterior division gives off the branches to the remaining muscles of mastication, that is other than the medial pterygoid, and all the muscles of mastication are supplied through their deep surface. So one branch it gives to the masseter called the masseteric branch. Other branch it gives to the lateral pterygoid. This is the nerve to lateral pterygoid. And then it gives two branches, anterior and posterior, deep temporal nerves. They are for the temporalis muscle. So this anterior division, it gives off the buccal nerve, which is the only sensory division of the sensory branch of the anterior division. Now this buccal nerve supplies the skin. It passes between the two heads of the lateral pterygoid and supplies the skin and mucous membrane in relation to the buccinator muscle. It also supplies the gingival area in relation to the premolar and molar teeth. So this was about the anterior division of the mandibular nerve. The posterior division of the mandibular nerve gives off the auriculotemporal nerve. It arises by two rootlets which encircle the middle meningeal artery, and then these two rootlets, they unite, these two roots unite to form the auriculotemporal nerve, and this auriculotemporal nerve lies in relation to the medial aspect of the neck of the mandible, and this auriculotemporal nerve, it is in relation to the medial aspect of the temporomandibular joint, and then it passes backwards and then it continues upwards, forming the posterior relation of temporomandibular joint. And this auriculotemporal nerve, it supplies the skin of the temple, the upper two-third portion of the external ear. It also supplies the external acoustic meatus and the tympanic membrane. It also supplies the temporomandibular joint, and this nerve gives the sensory and secretomotor supply to the parotid gland. So four things you have to keep in mind. Auriculotemporal nerve supplies the skin of the temple. It supplies the upper two-third of the external ear, and it also supplies the external acoustic meatus and tympanic membrane. Then number three is the temporomandibular joint, and then your number four is the most important one. It supplies the parotid gland, the secretory and the secretomotor and the sensory supply of the parotid gland. So this was about the auriculotemporal nerve. So remember that the auriculotemporal nerve arises by two roots and they are surrounding the middle meningeal artery. Now, the smaller terminal branch of the posterior division is the lingual nerve. This lingual nerve arises 1 centimeter below the skull. 2 centimeter below the skull, it is joined by the chorda tympani from the facial nerve. Now, the lingual nerve, this gives the sensory supply to the anterior two-third of the tongue. But the chorda tympani component is joining with it. And the chorda tympani, it gives secretomotor supply to the sublingual and submandibular salivary glands. And it is also giving gustatory supply, that is the taste sensation, for the taste sensation it is there. It is also gustatory to the anterior two-third of the tongue. So the fibers of the chorda tympani, which are gustatory, that is taste sensation, the fibers of the chorda tympani, which are gustatory to the anterior two-third of the tongue and secretomotor to the submandibular and sublingual glands, are supplied through the lingual nerve. So the fibers of chorda tympani are supplied through the lingual nerve. Which fibers? The fibers for these submandibular and sublingual glands, these are secretomotor, and gustatory fibers for the anterior two-third of the tongue. So this was about the lingual nerve. The lingual nerve, from its two rootlets, the submandibular ganglion is suspended. So there are, the submandibular ganglion is suspended from the lingual nerve, and this lingual nerve then winds around the submandibular duct, and it then gives its terminal branches. And you can see the lingual artery here in this diagram. So this was about the lingual nerve. Then we have the larger terminal branch of the posterior division of mandibular nerve, what is referred to as the inferior alveolar nerve. You can appreciate its vertical course. This inferior alveolar nerve passes through the mandibular foramen. So it passes through the mandibular foramen, and just before it enters into the mandibular canal by passing through mandibular foramen, this nerve gives off a mylohyoid branch, what is called the nerve to mylohyoid. This nerve to mylohyoid, along with the mylohyoid vessels, they pierce the sphenomandibular ligament, and then they supply the mylohyoid muscle, and this nerve to mylohyoid supplies the mylohyoid muscle and the anterior belly of digastric muscle. So the motor component of the posterior division of the mandibular nerve is carried into the nerve to mylohyoid. So nerve to mylohyoid contains the motor component of the posterior division of mandibular nerve. So once this inferior alveolar nerve enters into the mandibular canal, it supplies the lower teeth. Okay, and then it passes through the mental foramen to become the mental nerve, and this mental nerve gives branches to the skin of the chin, and it also supplies the gums in relation to the molar teeth and the canines. Okay, so this was about the inferior alveolar nerve. So the terminal branches are the lingual nerve and the inferior alveolar nerve. For lingual nerve, you have to remember the relations of the nerve also. So this nerve, lingual nerve, it arises 1 centimeter below the skull. It is joined by the chorda tympani nerve. So when this lingual nerve is arising, it is lying in relation to the between the lateral pterygoid and the tensor veli palati. Then it comes to lie between lateral pterygoid and medial pterygoid. So then this lingual nerve, it comes to lie between the medial pterygoid muscle and the ramus of the mandible. And then this uh, lingual nerve, it comes to lie in relation to the medial aspect of the molar tooth between the superior constrictor muscle and the mylohyoid muscle. So here this relation is very important, and the nerve lies in medial to the molar tooth between the superior constrictor muscle and the mylohyoid muscle. Then this nerve passes superficial to the hyoglossus, it passes superficial to the genioglossus, deep to the mylohyoid, and subsequently it winds around the submandibular duct to divide into its terminal branches. So this was about the lingual nerve. Its important relation is that it is lying medial to the third molar tooth and between the superior constrictor and the mylohyoid muscle. So we have already done this. This relation where it is lying in contact with the mandible is very, very important. In fact, in cancers of the tongue, the pain may be referred from the lingual nerve to the auriculotemporal nerve region. So here then we have to divide the lingual nerve, and where do we divide it? We divide it medial to the third molar tooth. So the clinical aspects are also important and you have to keep them in mind. So this was about the different divisions of the mandibular nerve. Now, how do you test for the mandibular nerve? Well, to test for the mandibular nerve, we ask the person to clench the teeth. And which muscle we feel here? The masseter muscle. So when the person opens the mouth, the jaw will be deviated. So the side to which the jaw is deviated, that side is the paralyzed side, because the normal lateral pterygoid will push the jaw towards the paralyzed side, because the normal lateral pterygoid is working. So if this side lateral pterygoid, medial pterygoids are working, they will cause the movement of the jaw towards the other side. And here they are not working, so there is no balance. So what happens is, when the person is asked to clench the teeth and opens the mouth, the chin deviates towards the paralyzed side. So this is how we test the mandibular nerve. Then regarding the lingual nerve, I have already told you. Then suppose a person is having trigeminal neuralgia. In that case, we know the location of the trigeminal ganglion in relation to the apex of petrous part of temporal bone. So the nerve is divided behind the ganglion before it enters into the trigeminal ganglion. So when we divide the nerve, we have to be careful that when we are dividing the sensory branch of the nerve, the superomedial portion we can spare, because that supplies the cornea through the ophthalmic division. So mostly the trigeminal neuralgia, the pain is into the maxillary and the mandibular division supply areas. So we can preserve the ophthalmic division supply area by not cutting the superomedial part of the sensory part of the nerve as it is entering into the trigeminal ganglion. So from the, this fifth nerve has got different nuclei. So it has got a motor nuclei, and then it has got mesencephalic nucleus, spinal nucleus, and the nucleus in the pons. So from all these nuclei, the mesencephalic, spinal, and the nuclei in the pons, the large sensory root is entering into the trigeminal ganglion. So once it is entering into the trigeminal ganglion, we divide it before it enters into the trigeminal ganglion for trigeminal neuralgia, and we do not cut the superomedial part of the sensory root because we do not want to damage the cornea. So this is another aspect, but the undergraduates need not focus too much into it. It's more important for the postgraduates. So then this mandibular nerve, now we have done in detail. Now there is an important ganglion, and that ganglion is called the Otic ganglion. So that is lying in relationship, topographical relationship to the mandibular nerve, because this ganglion is lying below the this foramen ovale. Yes. So this ganglion is lying in topographical relationship to the mandibular nerve, but this ganglion is in functional relationship to the ninth nerve, and the ninth nerve is the glossopharyngeal nerve. So what is this Otic ganglion? Ganglion is a small pinhead shaped structure. So it lies below the foramen ovale, and foramen ovale, when we think of foramen ovale, we think about the mandibular nerve. So this is lying in topographical relation to the mandibular nerve, and functionally it is related to ninth nerve. We'll see how this Otic ganglion, is important for the supply of the parotid gland. So let us see how. And this is a peripheral parasympathetic ganglion lying in relation to the mandibular nerve, where the nerve to medial pterygoid is rising from the mandibular nerve. It lies just medial to the mandibular nerve. So let us look at the Otic ganglion and its relationships. So once again, I share the screen. So let me come to the diagram of the Otic ganglion. So here, you students, the important thing is that this ganglion is lying medial to the mandibular nerve. Okay, and this ganglion has got a motor root or the parasympathetic root. So the fibers of the motor root come from the lesser petrosal nerve. You can see the green line here. It's entering into the ganglion, and these fibers, they relay in the ganglion, and then the postganglionic fibers, they pass through the auriculotemporal nerve to supply the secretomotor supply of the parotid gland. Now, how do the fibers begin? The preganglionic fibers begin in the inferior salivatory nucleus of the ninth nerve. So the ninth nerve, it passes through jugular foramen, then gives the tympanic branch, and this tympanic branch forms the tympanic plexus, and the preganglionic fibers continue through the lesser petrosal nerve coming out of the tympanic plexus, and the lesser petrosal nerve passes through foramen ovale, and then it relays fibers into the Otic ganglion. The postganglionic fibers from the ganglion, they supply the secretomotor supply to the parotid gland. So students, you must remember that the secretomotor, that the secretion of parotid gland is due to the glossopharyngeal nerve. It is not through the facial nerve. Although the facial nerve is passing through the parotid gland, the secretomotor supply of the parotid gland is because of the glossopharyngeal nerve. And this is the pathway. The preganglionic fibers arising from the inferior salivatory nucleus. And you can see the preganglionic fibers, how they leave the glossopharyngeal nerve as its tympanic branch, which forms the tympanic plexus. From the tympanic plexus, the lesser petrosal nerve is forming the motor root, and the preganglionic fibers, they relay in the ganglion, and the postganglionic fibers go on to supply the parotid gland. So this is how secretion from the parotid gland takes place. Then the sympathetic root is formed by the plexus around the middle meningeal artery. And this plexus is formed by the postganglionic fibers arising from the superior cervical sympathetic ganglion. And from this plexus, this sympathetic root is coming, and it is not relaying in the ganglion. The fibers are passing as such through the auriculotemporal nerve to supply the parotid gland. And the sensory root is formed by the auriculotemporal nerve, arising from the posterior division of mandibular nerve, and the fibers pass without relay through the Otic ganglion to go on to the parotid gland. So this was about the Otic ganglion, which is lying morphologically in relationship to the mandibular nerve. It lies medial to the main trunk of mandibular nerve, just where the nerve to medial pterygoid is arising. But functionally, it is in relation to the ninth nerve, because it is the ninth nerve which is responsible for secretomotor supply to the parotid gland. There's a pathway there, and you can make out how the ninth nerve is giving preganglionic fibers which enter the Otic ganglion, and how from the Otic ganglion the postganglionic fibers are arising to supply the parotid gland, so that the parotid gland is able to secrete its secretions. So this was about the otic ganglion. Sometimes the question comes in the examinations on the otic ganglion. So students, today we have done two important topics, the mandibular nerve and the otic ganglion. Kindly go through my notes and kindly go through this video again. And I hope that you will be able to form a concept in your mind which will help you in your future. So thank you, students. And till the next time we meet, it's bye from me. Take care.